Good morning to everybody. Thank you for inviting me to this wonderful meeting. I'm very delighted to be here because I love Ireland. And one of the reasons why I use Irish dance is because I love Ireland. And I have the honor, the privilege to work in this old abbey of the 15th century, built on the ruins of a Roman castle. And now actually is a Parkinson Excellence Center. And our mission is to address a comprehensive model of care for patient and their caregiver with outpatient and inpatient programs. And so it's a very nice place where to work. And in the last year, there is emerging evidence on the effectiveness of the complementary alternative therapies for Parkinson's disease, such as dancing. This is very important because these strategies, these interventions stimulate emotions and motivation. And it's very important for the adherence to the programs. And why I decided to use Irish-step dances. The reason is because I was in this pub many years ago. This is a pub located in County Clare. The name is Pepper's Pub, where I used to go for an Irish session to play. I was there one night, and a man with Parkinson's disease with typical shuffling gait entered into the pub, and he started to dance in front of me. So I was very impressed because he danced very fluently. And so when I came back to Italy, I started to write a study design using this kind of dance to rehab a patient with Parkinson's disease. First of all, music is very important for the brain because music involves all. As you can see, this is the brain of a musician. Involves all the brain, not only the cortical, but also the subcortical regions. And so to play an instrument is very important for the neuroprotection. And Irish set dance, Irish music in particular, is a music that has a very strong auditory cues, rhythm, that works deeply in the brain and permits to the patient to walk better, especially to improve the freedom of gait. And when I came back, as I told you, we did this randomized control trial, and we published this article. And after this article, also the group of UL, Limerick University, with Joanna Shahanan, she's a very brilliant PhD student, they published other articles documenting that Irish set dancing improve not only mobility, but also balance, gait, and also quality of life. And here are the reason why Irish set dancing seems to be effective in Parkinson's disease. And but the most important thing is that dance is enjoyable, and so permitted to the patient just to dance. And sorry. Here, just some, the organizer asked me just to show some videos. This is one of the videos that we use different techniques to showing. Okay. This is, for example, the warm-up session where with exercise for balance, without music before, and then with music. Set dancing without the music and with music. And this is a very interesting, this is the real step, it's a typical step of dancing. It improves the advancement of the lower limb during the swing phase, where the patient with Parkinson's disease, they have problems. And so we documented an improvement of rhythm of gait too. This is sorry, can you start a bit? This is a documentary, just a few seconds, recorded by my patient. This is our class in Venice of Irish Society. Martinez, this really famous Irish fiddle player. And we had the honor during this conference, which was held in Fickle in County Clare. And many thanks to the Pat Hayes, the organizer, and all the community of the Fickle. They invited me with my patients for a conference, for one exhibition. And it was a very great meeting. And just a few seconds of video.
But Irish step dancing could improve your quality of life. Many thanks for your attention. Thank you.
And now Martinez, he started to play fiddle with the typical rhythm now. We can through. Oh, and I had the privilege to be invited here in Dublin to the Parkinson Association, Move for Parkinson, by Max Mallarney, the president. I was really impressed by the great job that they are doing with Irish step dancing. They are still dancing, actually. And this is a very important book, Informative Resources for Teachers for Parkinson Patients, made by Joanne Shahanan, the PhD student from UL. And I think that it's a very, very precious document. This is another video of a performance of my patients, because they are still performing after 8 years. And so finally we have the honor to win the mention as a non-pharmacological project here in Ireland during the Irish Healthcare Awards. And so many thanks for your attention. Thank you.